So what's inside a joint replacement? It's usually a combination of a couple of things. We'll start with the knee because there's less kind of options, and we'll move to the hip. So normally when you get a joint replacement, what they're doing is they're in the knee, they're taking out your ACL, they're taking out both your meniscus. So if you tore those, no big deal. They actually are kind of cutting out the old joint sort of around to make a nice surface that a piece of metal can implant on. Sometimes you'll leave the PCL, sometimes you won't, depending on the surgeon who's doing the joint replacement. But anyways, so what happens is after you kind of prepare these bony surfaces, you take a bunch of cement, and then usually it's metal. So it's metal on the bottom and it's metal on the top. And you don't want the metal rubbing on the metal, which I'll get to in the middle. So what they do is they put a very high quality piece of plastic called polyethylene inside the middle. So you have cement and metal on one side, cement and metal on the other side, and then a piece of plastic in the middle, and that's sort of the bearing surface. Underneath the kneecap, they'll usually put a little piece of plastic as well. It's called the patellar button. And in knees, that's generally almost what's always done. Some people have started for the tibia part of the knee, they'll start just taking a giant piece of plastic instead of metal plastic. But again, the bearing surface is still like plastic on metal. So generally, that's what's inside a knee joint. The metal, it's usually cobalt, chrome, some sort of very durable metal. There's a whole topic about metal allergies, which I'm not going to get into. But anyways, for the hip, you sort of have the same thing for the most part, where you replace the ball, so the ball is metal, you put a socket in, that's metal, and you have a piece of plastic in the middle, the poly they call it, the polyethylene, and that's plastic. There's other sorts of variations you can use. Sometimes in younger patients, they'll use a ceramic head. Now it's not like as brittle as like a piece of clay, it's like a high quality ceramic, and they apparently wear better. So they'll put ceramic and then plastic and then metal, or you can do like ceramic on ceramic, although the side effect is it may squeak really loud, and all sorts of kind of combinations of those things. The only thing you won't see anymore is metal on metal. So you've probably heard about metal on metal hips. What happens is the idea was they tried to do this a long time ago, and the machining wasn't good enough, so they thought that if they could get metal on metal that it wouldn't wear so much, because the plastic sort of wears out. So the idea was, hey, let's just do metal on metal and it won't wear as much because metal will wear less than plastic. But what happens is it does wear, and it makes all these little tiny metal ions, and they kind of go out of the joint, and then your immune system attacks them and ends up degrading all the soft tissues. I've seen a few of these opened up and it looks like sort of a pen exploded. That's the best way I can put it, wherever that joint is. So they stopped doing those. There's class action lawsuits. So metal on metal is really the only thing they don't want to do. But by and large, it's metal, plastic, metal. And that's pretty much what everybody has. There's a lot of nuances of the different material types and how they're made. But unless you're a joint surgeon taking your boards, it's not really super important. All right, so I hope I was able to answer your questions about what's inside a joint replacement. If you like this video, we put out new content weekly, so please like and subscribe. If you have any questions I didn't answer, feel free to leave them in the comments below, and I'll do my best to respond. But I can't give you any specific medical advice because this video and all my videos are for educational purposes only. Thanks for watching.